Back pain sufferers, it's time to get your back back.
I've always had problems in this area.
The pain in my neck is a sharp pain. When I sleep, it hurts, When I turn my head around, it hurts.
In my back, all the way in the left hip and down to my knee.
That fear in the back of my head that if I do this movement, is it gonna hurt?
I would call it a sharp pain.
Every time I try to do things, it just starts hurting again.
Most of my pain is in my shoulders and in my neck.
If I feel this way now, how am I going to feel 10 years in the future?
Do I have to live with this back pain forever?
For thousands and thousands of people, many with pain just like yours, the answer to that question is a resounding no. Is there any reason for anyone to have to live through the suffering, discomfort, and torment experienced by the people you've just seen talking? Now, listen to what they've got to say.
Has changed my life considerably. Having to deal with continuous pain and being free from it is a marvelous feeling.
I can go up steps, down steps. I'm living my normal life.
I've had neck pain for over 10 years due to a car accident and having to have surgery. Now, since I've started the therapy, I am completely pain-free. For me, that was a miracle.
It feels great. I love doing all the things I couldn't do when I had the pain.
If you know what it's like to have serious back pain, this kind of relief can almost seem miraculous. But what they have in common is that they've all experienced a remarkably effective and totally non-invasive back treatment procedure called the LCD Spinal Care System that's offering relief for many spinal ailments. Hi, I'm Andy McCavan, and joining me today is Dr. Min Lee. Good to have you here, Dr. Lee.
Thanks, Andy.
Everyone watching would be interested in learning more about this remarkable treatment method, especially from a doctor who has extensive clinical experience with it.
I'm really excited about the opportunity to be here to tell people about the LCD Spinal Care System. LCD, by the way, stands for Lumbar Cervical Decompression.
Before we go any further, why don't you tell us a little bit more about yourself, Dr. Lee?
Well, Andy, I'm practicing internal medicine, specializing in pain management.
And it's why we're interested in having Dr. Lee talk to you about the LCD Spinal Care System. He's considered an expert in the field of spinal biomechanics, the study of the structure of the back. And he's always looking for new answers and treatments that can take a patient's back pain away. And he thinks he's found one in the LCD Spinal Care System. Dr. Lee?
Absolutely correct.
So, if you're watching us right now and you're suffering from back pain, leg or hip pain or arm pain, or you know someone who's got unsolved back problems, do them a favor. Call them on the phone and tell them to tune in. Because for the next half hour, we're going to be telling you about a revolutionary back pain treatment that doesn't involve drugs, doesn't involve risky surgery, doesn't involve difficult exercises, and it's safe and proven to be effective for thousands and thousands of people, many of whom are now entirely free of pain.
The medical communities are very excited about the LCD Spinal Care System. And by the time we're done with our show here, I think you'll be excited too.
I'm sure they will be, Dr. Lee. But before we dig into this fascinating topic, I'd like our viewers to learn some things they may have never known about back pain.
45% of adults on disability are disabled due to back pain, the single biggest reason in the U.S. More than 65 million Americans experience back problems every year. Only the common cold causes more people to miss work. Americans spend at least $50 billion each year on treating back pain. Almost 6.5 million people in the United States will be treated for back pain today.
And now we're going to show you how you can get your back back with the LCD Spinal Care System. Right, Dr. Lee?
That's right. It's definitely an alternative that anyone with back pain should investigate. That's my opinion, but based on published data and my own experiences treating my own patient with this type of therapy, it's the way to go. The LCD Spinal Care System is a relatively new type of treatment. For many patients, it's an alternative that many professionals like myself are recommending, either before more risky or invasive courses of treatment are considered, or where more traditional chiropractic or physical therapy methods have failed to relieve the patient's pain.
And why is that?
Well, let's look at what else is out there. There's the painkillers, the muscle relaxants, which are drugs. There's physical therapy, there's bed rest, and finally, there's surgery.
Why and when would you choose the LCD spinal care system over other treatments?
Due to its excellent clinical track record, it has become my first choice for many cases. And unlike surgery, it's non-invasive, and I feel that it's very important.
And we'll go further into that in a moment.
Yes, that's right. We've got some information about surgery that may surprise our audience. But back to the other treatment methods. Compared to typical physical therapy, many patients tell us LCD takes less time and can cost less money.
Really?
Bed rest, yes, but that can also help. But how long can you afford to lay up in bed? Most of us have jobs to go to, and additionally, after just a few days in bed, you begin to lose muscle strength. And finally, drugs. Obviously, there are a lot of issues there. Risk of addiction and side effects that can endanger the kidneys, the liver, and other vital organs. Also, it's been proven there are really no drugs effective for sciatic leg pain. And muscle relaxants are just sedatives that restrict driving and many daily activities for most people.
I tried massaging by myself, taking medication to relieve the pain. It did temporarily, maybe 1 to 2 hours, but the pain just came back, and I knew I couldn't take medication forever.
I had checked into some other type of things. Of course, I went for 4 years after the surgery with a lot of limitations, and I didn't know that I would ever be able to get back to normal.
Not good.
No, not good. Let's talk about something that we don't talk about a lot, is the failure rate of back surgery.
So you mean people go through all that risk, the anesthesia, the chance of nerve and muscle damage, and the pain of recovering from an operation.
Right.
And the scarring.
Right.
And then there's the time that it takes to get back on your feet again. People go through all of that only to find out that it didn't work.
That's correct. They end up back where they started, back pain-wise, or even worse. It's called failed back syndrome, and it's a surgeon's and their patient's worst nightmare.
You don't hear about that part of it, do you?
No, not often enough. But now with the LCD spinal care system, if you've got back pain, you've got a new alternative. And its rate of success is much higher. Approximately 7 out of 10 patients feel relief of their back pain with LCD.
And that's without all the drawbacks of the other treatment options that you just covered a moment ago.
That's right.
Well, that's amazing. I mean, for our audience out there, the LCD spinal care system really sounds like a major advance in back treatment. Is it?
In many ways, it is, but it's based on some very logical and intuitive and scientific medical principles.
The LCD spinal care system works by actually allowing the spine to stretch in a very precise and controlled way. Because the stretching action is extremely gradual, actually controlled by a computer and biofeedback, the discs between a vertebrae are actually stretched, creating a vacuum-like effect. This vacuum can, in some cases, help retract or draw in a herniated disc that may be pinching a nerve, as shown here.
Some patients feel relief after their very first LCD spinal care session. Some 7 out of 10 patients that come in for LCD walk away with their back pain problems dramatically improved or eliminated.
No, I'm fine. I do everything again now. Not one thing I don't.
After decompression therapy, I feel more energy. I feel happier. People around me doesn't irritate me as much. I feel like, they don't bother me like they used to. That's how I felt. It's a lot more energy and a lot more happier.
Since the decompression's been done, it seems like there's, no pain at all due to any discomfort of sitting and being bounced around or twisted.
Now that I'm pain-free, I feel really happy. I don't have to worry about the pain anymore. It's not in my head. Treating people a lot better than I have ever before. And I just feels like I have my old life back.
That's really amazing.
It is a whole new approach to back pain that leaves all the problems connected with the traditional treatments behind.
Well, now we're going to give you a chance to learn where you can obtain this remarkable treatment, this new way to get back pain out of your life for good. Dr. Lee, I see you've got a collection of, what are those?
What I have here is basically a representation of your spine. Your back is basically made up of these individual vertebrae, which are your bones, and in between them are shock absorbers, called your disc. And your disc is made up of 2 parts, the nucleus, the middle part, which has all the nutrients, and an outer part, which has receptor cells on it, which can cause back pain. And this shows what can happen when you injure your back, such as when you're falling in an accident, running, or walking. Sometimes just any pressure that you put on it can injure your back. This is what's called a herniated disc. You're going to have a lot of pain. The pain can go down your leg, which is called sciatica.
Dr. Lee, can you give us a few more examples of causes for back pain?
An auto whiplash injury, when the neck bends back, can cause pain. In the low back, an injury at work where you're just bending over, picking up a light box. Other injuries are basically sports injury. And over here, I have another model of an older person. Due to aging, these vertebrae can become very small, compressed, and also the disc can become very compressed and very inflamed and dry.
And that's degeneration.
And this is degeneration.
So what's this one here?
This one here is what a normal disc and vertebra would look like. And we can get it to this stage by using the LCD spinal system. And the LCD system works by pulling on the vertebra or distracting it, creating a negative pressure in the nucleus, thus sucking in the nutrients, the water, the oxygen, and also all the good things, and expelling all the waste, the urea, the nitrogenous waste, and all the bad proteins. And over time, through a series of treatment with the LCD system, your spine and the disc can become like this.
Well, that's amazing. Now I know far more about my back than I ever knew before, and I'm starting to understand why medical practitioners like yourself are so enthusiastic about the LCD spinal care system.
Well, it's an effective therapy, certainly with better track record than many alternatives I'm sure many people in our audience have tried or considering trying. LCD's been shown to work for about 70% of patients, and it's a totally non-invasive procedure, which means it's already got a built-in safety margin when you compare it to injections or surgery. And unlike simple bed rest, it's a proactive procedure.
I know that our discs are a major source of back problems. I don't understand how LCD helps them.
Take a look at this. Remember, the discs have no blood supply of their own. So unlike muscles, bones, and internal organs that get a fresh supply of blood, oxygen, and nutrients with each beat of the heart, discs absorb what they need very slowly from outside. If they're compressed by injury or by the effects of age or a sedentary lifestyle, they'll stay compressed, causing problems, and they can't heal themselves. They can't expand. But the computer-monitored pulling action of the LCD spinal care system acts to expand the discs to foster an improved healing response. Less compression equals more blood and nutrients.
I see.
That's why decompression with the LCD spinal care system is such a logical and intuitive treatment method.
And then once I had this done, it just was completely amazing. It helped so much.
After the therapy, my pain was totally gone. I felt a lot better after I laid on the table. And yeah, I just felt like a new person, like a new back was put in me.
I am a lot more active again. I'm a very active person. And I'm more active now since I can move around more freely.
Well, my attitude towards life has dramatically changed because now I can go out, I can do things, and I know that I'm not going to have pain.
In the last few minutes, you've seen a lot of hard evidence that says the LCD spinal care system is the way to go if you're looking for a way to get rid of your back pain. And you've also heard from a number of people who have actually gone through the LCD spinal care system. They started in pain and they ended with no pain. They got their backs back, and you can too. If you've been watching us all along, you know we've been talking about the LCD spinal care system, the medical breakthrough that can make your back problems a thing of the past.
I've been able to increase leisure activities and do things that I had been putting off, having a lot more fun, and also I feel like I'm more productive at work.
I don't feel hurt no more, and I feel good. I feel great in my life. I don't think about I'm hurting because I'm not hurting no more. I feel very good.
Because of the depression with the back pain, I think with the pain relieved, I'm more able to relate to people, more understanding than what I was with the constant back pain.
It feels great. Now I can play tennis and I can play softball and play all my usual sports.
The LCD spinal care system is a sensible, reasonable, and a clinically proven treatment. The LCD treatment equipment is FDA registered with proven safety and effectiveness.
When patients come to see me for back pain, they may not know it, but they almost always ask me the same 4 questions. First, what's wrong with my back? Second, can you fix it? Third, how long is it going to take? And fourth, how much will it cost?
Makes sense. That's what I'd want to know. Can you take us through those questions and show us how the LCD spinal care system fits into the answer?
Sure. Let's start with the first question. What's wrong with my back? An auto whiplash injury, when the neck bends back, can cause pain. In the low back, an injury at work where you're just bending over, picking up a light box. Other injuries are basically sports injury.
There are a lot of things that can go wrong with our backs. In fact, check out these facts and figures.
45% of adults on disability are disabled due to back pain, the single biggest reason in the U.S. More than 65 million Americans experience back problems every year. Only the common cold causes more people to miss work. Americans spend at least $50 billion each year on treating back pain. Almost 6.5 million people in the United States will be treated for back pain today.
And that leads me to the second questions that patients ask me. Can you fix it? Can you make it better?
How does the LCD spinal care system fit into that answer?
My own area of expertise, more and more of us are recommending the LCD spinal care system as their first course of treatment.
Why is that?
Well, it has a high success rate. It works in 7 out of 10 cases. It can help correct some of the causes of back pain and the problems I spoke about earlier.
The LCD spinal care system is effective in 7 out of 10 patients, stopping the pain associated with herniated discs, degenerative disc disease, sciatica, posterior facet syndrome, and general lower back pain. Of course, your specific response will depend on the extent of damage, your age, general condition, and other factors that will be taken into account.
And the LCD spinal care system is safe, it's painless, it's non-invasive, there's no surgery or injections.
This is the LCD spinal care system at work. As your spine is gently stretched, the vertebrae and discs separate or distract and the spine straightens. And here's what's really exciting. As the discs are stretched, a vacuum actually forms inside them and herniated areas can retract. But that's not all. The vacuum inside the disc also sucks in the fluids and nutrients the disc needs to repair itself and become supple again, to turn back the clock and regain the cushioning function it once had.
And that brings us to the third question. How long will it take for me to get my back?
Treatment with the LCD spinal care system doesn't take long at all. Many patients report that they begin to feel relief even by the end of the first session.
Instantly, when my back started stretching, I felt that my lower back was relaxing, and as soon as I got up from the table, I felt like I could jump up and down.
Within 4 treatments, I went back to work, and I haven't missed a day because of it since.
After about 10 treatments, I felt totally renewed. This was the greatest experience. I don't know why I didn't do this sooner.
Took about 15 sessions. I'm pain-free. I get to go play. I get to go dance. I get to do the things I like to do again.
And now comes the last question on your list. How much does the LCD spinal care system cost?
The treatment with the LCD spinal care system is very cost-effective for patients. Compared to surgery, it's only a fraction of the cost. And of course, not nearly as risky.
What about insurance? Is it covered?
And we can easily check to see if your care will be covered.
Well, that's good news for our viewers, I'm sure.
I tried everything from heating, icing, therapies that my athletic trainer gave me, but what really worked was the decompression therapy.
Now that I don't have any more back pain, the relationship that I have with my husband is much more fulfilling because I'm not grumpy, I'm happy, and therefore that makes him really happy.
Now that I've had the therapy, I feel refreshed again, and I just feel like I should have done it a long time ago. I missed out on a lot of time, but now that I have it done, I'm ready to go again.
Now, it's time to take the next step. It's time to get your back. For many, the LCD spinal care system offers pain relief that can seem miraculous. In a few seconds, you'll have one final opportunity to contact a clinical practitioner about the LCD spinal care system. So, jot down the phone number you're seeing on your screen now and be ready to call. And thanks for staying with us. We hope this program will be the start of your recovery from back pain. The LCD Spinal Care System. It's time to get your back back.
Just given me so much more energy, and very grateful to the doctor and the table, and and that I walked in here.
Now that she's pain-free, she can run around and I can see a smile back on her face.
The main thought is, why didn't I find this sooner? Why did I wait so long?
I have my little girl back.
I just want to thank whoever designed this machine that made me pain-free. Thank you, and thank you.
Before I had the therapy, I was concerned about how much it would cost. And finally, when I went and did it, it was definitely worth every penny of it. Now everything's changed and I'm completely comfortable. So I would pay it again. I would pay twice as much.
I started this therapy about 2.5 months ago. Within the first 2 months, I was completely pain-free. I just wish I'd known about this before I had my surgery.